Oh, technical problems have been resolved. Thank God.
Hello. Can everyone see me okay?
You're a little square on the bottom right hand corner of my screen. I don't know if that's normal because it's the first time I've ever done this, but I'm hoping it is.
I don't know. I'm not sure. Usually it's like two people on the screen. We are so bad at this. I'm so sorry, guys.
I know.
Everyone
so this is the first time. We are babies in the realm of Instagram Live. This is the first. Or TikTok Live. Sorry, not Instagram Live.
Hooray. Oh, well, thank you everyone for your patience anyway.
So there was already a couple of questions, which I've very introductory questions, really. So how do we want to structure this? Should we just go through our individual stories? Sarah, what do you think?
Yeah, and I think just in general, how to become a dermatologist. I don't think people realise the steps that are involved in becoming one. I think that's quite helpful for people to know, and I definitely get asked that a lot. But do you want to begin? Tell us a little bit about yourself and how you got here.
Absolutely. Yeah. So, where did it all start? I was probably about 20 years old when I kind of really made the decision. It was the second year of medical school. And for people that don't know, in the UK, medical school is either 5 or 6 years. So I was on a 6-year program in Cambridge. And it was in the second year where I remember, telling myself that dermatology was the right mix of skills that I wanted to develop, the kind of right mix of, both practical and theoretical skills. I wasn't really sure that I wanted to go down a surgical or a medical path. So in that sense, it's quite kind of nice because you can do both in dermatology. And after I'd made my mind up, I then gradually began to kind of do I didn't do much in medical school, just kind of a few bits and bobs. I did an elective in Japan in dermatology, which is really useful just to get experience. And then in my foundation years, which every doctor after they graduate from medical school has to 2 years as a foundation doctor. And in my foundation years, I had a rotation in dermatology for 4 months. And typically you've got 4-month rotations when you're a foundation doctor. Following on from that, what I did was 2 years of core medical training, which it was known at the time. Now it's changed into something called internal medical training, which is essentially a further 2 years of general medical training that you have to do before you get accepted into the dermatology program. And then after that, this proper bottleneck comes on where there's a huge number of people wanting to apply to be dermatology registrars, or to enter the dermatology training program. And I applied from that point to go into dermatology. And it's a national program. So you kind of choose where you want to be in the country, but you can't be very prescriptive and say, I definitely want to be in this city because it's so competitive. They've only got something like 35 places for about 170 applicants. So it's good going competition at that stage. And that's where I am right now. So I'm in coming into my third year after entering the program. Sarah, do you want to run us through your history so far?
Yes, of course. So for those of you that don't know, all dermatologists actually go to medical school. So I'll start with that because actually a lot of people are surprised that we went to medical school. But yes, dermatologists in the United Kingdom are all medically trained doctors. You have to do a medical degree at a recognised university. So I did mine in London, and I think you did yours at Cambridge. Is that right?
Yeah.
So I did mine at University College London. It was a 6-year degree. And then after that, you have to go through medical training, which in total is 4 years after the 6-year medical degree. So you do about a decade of training before you can even come to apply in to do dermatology. I actually decided I wanted to be a dermatologist in my first year. I don't know.
Straight in there. Yeah. You knew, yes, I want to be a dermatologist.
Yeah, well, we had a lot of lectures. Our first year was very heavily science-based. And we had a lot of lectures on skin structure, skin anatomy. And immediately I was like, oh my God, I love this. This is amazing. This is what I want to do. I was a bit put off, obviously, by how competitive the specialty is. Unfortunately, in the UK, there's not many dermatology places available, so it's highly, highly competitive. I believe about seven applications for every position available.
Probably about 7 to 1 at the moment. Yeah.
Yeah, it's about 7 to 1, isn't it? So there's not many places. So after you do the 6-year medical degree, you have to do about 4 years of medical training. So that's when you're a junior doctor in hospital. It's called foundation training, and then internal medical training. At that stage, you apply. And I was very happy. I obviously worked hard, but I feel like I was very lucky enough to get in as well. And then after that, it's 4 years of dermatology training, which is what we're both doing at the moment. And at the end of those 4 years, we will be consultants. So that's exciting. We're nearly there. I think you're a year ahead of me, aren't you? So yes.
Yeah, we're pretty close anyway. We're close to where we are. Although I haven't seen you at a conference yet, but that's probably going to change. We all tend to go to similar conferences, and I'm sure we'll see each other.
I've been to a lot of virtual conferences, but COVID has obviously put that on pause the last 2 years, but hopefully in the upcoming years, definitely. So that's how you become a dermatologist in the UK anyway. So it's quite a long route, but if it's something that you're really passionate about, then I definitely feel it's worth it. And I definitely recommend it to any medical students that are out there that are thinking maybe this is the route they want to go down. But yes, what do you think? Any tips? Give any specific tips you would give anyone if they're thinking of becoming a dermatologist?
Well, I was doing a bit of reading actually before I came on tonight, just to make sure that I knew every single possible path to entering dermatology training. And there are new paths now. One new path in that you can do surgical training after your foundation years. So you may decide initially you want to be a surgeon and do your 2 years of surgical training. But then if you change your mind at that point and say, you've done your surgical training, I want to actually be a dermatologist, you can then do a further 12 months. You have to do 12 months of kind of medical practice in a hospital. And then you're kind of essentially able to convert and able to apply to dermatology. And that's something new, which has only been available as a route since 2021, I think. So fairly recent. There is also another route through pediatrics, which is something kind of very uncommon. I don't really know many people through that route, but you can do 3 years as a pediatrician after your foundation years and then apply. Or acute care common stem, which is doing kind of acute medicine for 3 years and then applying. So there are different ways after your foundation training. So it's just something to bear in mind. I said the easiest way is to do what we've done, is to do the 2 years of internal medical training. It's probably the quickest way as well, really, in the UK. And that's probably the extra that I would add there. It'd be interesting to see what level or, what you guys do I think there's 10 people in the chat at the moment. But if you just write it out there, say, are you a medical student? Are you aesthetician? Just interested in skincare? It'd be interesting to know what kind of people our audience are as well. We've got a few comments by 14 Pizza in the chat as well.
I enjoy the one about the conferences. What do you do at conferences? Do you look at
You want to answer that one?
Yeah, so what do we do at conferences? So in dermatology, there are thousands of different skin conditions that can affect people. Some of them quite common, such as eczema, psoriasis, acne. Some of them, they're a lot more rare. So dermatology is quite an academic specialty. And what I mean by that is there's quite a lot of research that goes into the different treatments that we have available, not just the skincare that we often talk about, but also the medically prescribed medications. So that includes the topical treatments as well as tablets and IV injections. Behind all of that goes a lot of research. So when we go to conferences, really what we're doing is we're going to learn and we're going to share information, keep up to date with the current research that's out there. So often we try to go to conferences minimum at least once a year. I don't know how often you go. I try to go as often as I can. Depends how much study leave I get, but it's really, really important.
They try to encourage us in Leeds, actually, to try and go to at least a couple in the year. Yeah, it's useful going to conferences, and you get to meet your fellow dermatologists as well. It's always quite a nice social event, as well as being a good focus of learning, because as you can imagine, as a doctor, the learning never stops. You're just always learning something new. You always, I mean, you do get to a point where exams finish, that's true. But then you always have to keep up to date with the latest findings in dermatology, and things always change. You know, drugs change, different kind of indications change. I mean, some drugs get red listed, so you always have to be aware of what's changed, and it just requires constant learning from that perspective. Chelsea, I know Chelsea quite well. She's we frequently talk with each other on Instagram. You went to law school, but you've gone into something dermatology related. Now, but you're one of the best educated people on my Instagram, Chelsea. It's incredible how much you know, considering that, you know, dermatology is just an interest for you. So, you know, you've definitely picked up a lot, and that's admirable.
Yeah. And she went to law school as well. Like, she's highly educated in a number of different realms. So that's absolutely amazing.
I could never do law school. Oh my God. I know my lawyer friends, and I don't envy them having to read legal text.
Yeah.
And then Leanne says aesthetician.
Yes. Yeah.
It'd be interesting to know from an aesthetics perspective how things are different compared to what we do. Or do you guys go to conferences as well? How much do you have to keep on top of kind of regular learning? That'd be something interesting from my perspective of knowing as well. Have we got any other questions? I mean, there's a few before. Is it easier than being a paramedic? It's like comparing apples and oranges. If you ask me, being a paramedic sounds quite difficult. Definitely more kind of physical, and
they're both
going to emergencies.
Yeah.
So I think it's difficult to compare that. How do you test the skin to find out what's wrong?
So investigations. So how do we test the skin to find out what's wrong? That's a very good question. So we start by assessing clinically. So the reason I picked dermatology as a specialist, I don't know about you, but one of the reasons I picked it is it's very visual, it's very aesthetic. A lot of the diagnosis is made via the clinical examination. So you start by assessing visually. We have different patterns that we as dermatologists are trained to recognize. Certain patterns specific, kind of are linked to a specific set of conditions. So we start by that, but then we have lots of other investigations too, such as blood tests. We can test for antibodies. We can do skin biopsies, which is something that we perform at work. I'd say I probably do that on a daily basis. I don't know about you, but...
Daily? Oh, wow.
Yeah, my hospital's pretty busy, so I do skin biopsies quite often. And we just take a sample.
Twice a week for me.
So we take samples of the skin. So, for example, we might be querying a cancer. We might be querying some kind of inflammatory condition, but we don't know which type. There are certain things under the microscope that can tell us what the underlying diagnosis may be. So, we take biopsies of the skin, we look at them under the microscope, and that helps us. Other investigations, we can do tests for allergies, such as patch testing. Do you have that available in your hospital? I imagine that you do.
We've got everything almost available, really, to us.
So patch testing is really cool, because if people present with a condition that we call allergic contact dermatitis, so that's where you develop a sort of allergy to specific allergens within, for example, skincare, but you don't know which one, and you need to know which one so that you can avoid them. There's certain tests that we can do where we apply patches to people's back, and that helps us. But
I'm on that rotation at the moment. So
are you?
My rotation is patch testing, which is great. So I'm learning lots about patch testing and a cutaneous allergy. And there are a million and one allergens, and you will never be able to get all the pronunciation right. I try to pronounce the full names, but sometimes you get tongue twisted.
I just use the initials. Yeah.
Yeah.
But yeah, Chelsea says, thank you for the sweet comments.
And then she also asks, in your opinions, why has hydroquinone gained such a poor reputation? I think it's an amazing drug. I think we can both answer a bit on that if you'd like, Sarah. I mean, it's interesting that, because personally in the NHS we don't really go down the route of prescribing hydroquinone. That's more in the kind of cosmetic private dermatology world, where doctors seem to be doing more of that. And it's probably, maybe it's gained such a poor reputation for people misusing it, going for a bit kind of too high a concentration, and then potentially leading to side effects such as ochronosis or kind of dyspigmentation if misused. So it's not personally something that I've routinely prescribed my patients, mostly because of the regulatory structures around me preventing me from doing so in the formularies. What do you think, Sarah?
Yeah, so actually in some countries, in America, hydroquinone was previously available over the counter. I don't think that was ever the case in the UK. However, I have read that in America now they've stopped that, so it can only be prescribed by a doctor. It can be an amazing medication for hyperpigmentation. So I do agree with Chelsea. It can be an amazing drug, but it needs to be used carefully, and for that reason I'd advise you to be guided by a dermatologist. The reason for that is if you use it for too long, there's a condition that you mentioned, exogenous ochronosis. It leads to permanent pigmentation changes, and it's irreversible, and there's nothing really you can do about that. So for that reason, hydroquinone has now gained a poor reputation, and it's because of misuse, really. It's a drug that I have prescribed before, but I feel that you need guidance from a dermatologist before you start using it. And yeah, for that reason, I think we've done the correct thing by making sure it's more tightly regulated. Yeah. I
mean, hopefully we haven't kind of scared you with that answer. Just saying that, dermatologists do prescribe it, but it's done under controlled conditions.
Exactly.
Frequently in the private sector. And yeah, maybe it's kind of gone under too much of a bad rap, and people are concerned from that perspective, really. What's the next question we've got? What are the risks if you mess up, and have you ever done it? There are different degrees of messing up. I would say, there's the degree, of course, something catastrophically can go wrong, and then you go to a hearing and, have to face kind of potentially even legal implications. That's that end of the extreme end of the spectrum. Then there are the kind of lighter things, such as you may have slightly, put the drug dose at the wrong time, say, or you made a small mistake in that regard, or you haven't gone to see a patient quickly enough and they've complained, something like that. So I think in that scenario, then in that area of the spectrum, nearly all doctors have made mistakes, and it's impossible to say. I don't think take a brave doctor to say I've never made any mistakes in my career, because that's part of being human, is saying, making a mistake and learning from it. And believe me, they do make us learn from any mistakes we make. We have to reflect on that particular mistake. And we have to upload it to our portfolio and just ensure that we can learn to be better in the future. I'd say it happens, generally quite rarely that you'd have to do that, but no doctor is impervious to that problem, I'd say.
Yeah. And I think one of the most important things that you said there is that we are encouraged to reflect on our practice. So I think reflection is just an important thing that everyone should do, really. But specifically as doctors, we are asked to reflect on the things that went well, as well as the things that we could improve on in the future. And ultimately, that's how you learn. And that is how you become a doctor, a better doctor at the end of the day, isn't it? So, but yeah, no, that's a very good answer to that question.
14 pizzas, just absolutely rocking the questions here. I love it. Do you ever give out medication that will take years off your life? Different medications.
I don't understand that question. What does 14 pizza mean?
That shorten your lifespan.
Oh.
That is, I suppose, in some respects, can be quite a loaded question. In that, doctors never set out to give medication to knowingly affect a patient's lifespan. That's not our intention at all. Of course, sometimes in, very powerful drugs, which are needed for a very specific indication, if it's extremely affecting someone's quality of life, or, you know, if they've got, say, a cancer or something like that, then you may give them quite a powerful chemotherapy with the aim of trying to make them live longer. You know, we don't go about, you know, thinking in a way of taking years off people's lives. What do you think?
Yeah, exactly. I mean, we're only here to do good at the end of the day. We're only here to help people's quality of life and help their health. That's the reason why we became doctors. Yeah. I've got a question for you. What surprised you the most since becoming a dermatologist? What's been your biggest surprise? Maybe something that you didn't realize.
Ooh, that's a good question. Biggest surprise since becoming dermatologist. That's quite a difficult one, because it's been, so I didn't mention this before, but I actually did a fellow year, which is like an extra year in between finishing my medical training, my internal medical training after foundation years, and entering the program. So it's racking my brain a few years back now. What's caught me most by surprise? I think the pressures of skin cancer in our dermatology service. I've got to say, I did not realise before coming into dermatology that in the UK we are under such pressure to see skin cancer, and I think it's affecting a lot of departments UK wide. The demand from patients is extremely great. And, you know, the truth is that we don't have, you know, an unlimited supply of doctors. We have to, there's only X amount of doctors for so many patients. And as the demand has gone up, they haven't radically increased the number of us doctors being able to run skin cancer clinics. So seeing the pressures of that service and sometimes how many patients you need to see, sometimes I kind of, at this stage, see 12, 13 patients in the morning for query skin cancers. I would say that's probably my one. Maybe not the most exciting answer, but there we go. What about yours?
No, so similar to you, I am very much aware that the NHS is under huge pressure. Perhaps COVID has obviously increased the waiting lists as well. But yeah, it came as a surprise to me just how much workload dermatology departments really have. But at the same time, that also exposes us, I feel, to a lot of learning, because we see a lot of patients and we are actively involved in the department trying to help them get through that workload. So I feel like I've learned a lot through doing that. So that's been really good. It has surprised me just how much we need to know as well. I mean, medical school was obviously very difficult. Medicine is very difficult. You have to know a lot of information. But it surprised me when I started dermatology, just how much information there is out there in terms of not just knowing a medical dermatology condition, but also knowing the histology associated with it, also needing to know all of the different medications used to treat it, knowing all those medications, what their indications are, what the contraindications are, what the possible side effects are, just things like that. I think, that surprised me, but at the same time, I've been through medical school, so I guess I'm used to it. But yeah, I don't know. I
suppose what makes it more difficult is that they barely touch on it in terms of your previous exposure to dermatology. It's not as great as you may think during your foundation years and your core medical training years. So you don't get the proper exposure you need until you then start and then get hit by this wave of, I need to know all of this extra information, which I didn't know as a junior doctor before that. So that probably makes it more difficult in that sense.
So Luke's just asked a good question. Luke's a medical student in South Africa. Hello. What's a big misconception about dermatology? So one of the biggest misconceptions, I think, is that a lot of people seem to think it's quite easy, very chill, very relaxing.
Yeah, that's a common one we get.
That is a very common one we get. I mean, it's easy in terms of our work hours are quite nice compared to other doctors. I still work weekends. I don't know about you, but I still work weekends.
We're rotated for weekends as well.
Yeah, so even as a dermatologist, I still work weekends. I do sometimes finish quite late as well in the evenings. So compared to other doctors, I guess we are lucky in that we don't work night shifts. But we are quite busy. As you said earlier, you know, we have a huge demand, especially in the UK. So it is a struggle. I feel when I'm at work, I don't really stop. What do you think?
Yeah, I think
where you are?
That's a very good point. Also, from thinking kind of externally, from people looking outside of medicine, a lot of people probably think dermatology is just aesthetics and cosmetic stuff, and they don't realize that we have to go through the kind of, you know, rigorous medical training which we need to be able to do our job properly. And you know, I've had a couple of students sit in with me, kind of pharmacy students or kind of students from other fields, and they didn't realize until they came and sat in with me that we also take a full medical history. We're looking for more things than just the skin or just from a cosmetic angle. You know, thinking about all the other organs in the body and what can go wrong with them is important in order to link that with disease of the skin. And that can be irritating sometimes, in that people not knowing that and thinking, oh, all you do is just kind of cosmetic stuff and Botox and fillers. And that, you know, a lot of dermatologists don't enjoy doing that stuff. They don't all do Botox and fillers. And I think that is not known enough in terms of people who are external to us, and hopefully we can get that message out a little bit better. Than it's more than just skin deep. Our job.
Yeah, no, I agree. That's definitely a very common misconception that I've come across as well. What are the most? Oh, that's a good question, Chelsea. There. What are the most surprising emergent treatments?
Shall I
Do you want to go first? You can go first and then I'll answer. Yeah, you go ahead.
Exciting emerging treatments. That's an interesting one, because we're seeing a lot of exciting new treatments in the field of eczema, atopic dermatitis. We've got a new subset of medications which are out called the JAK inhibitors. Well, I say new, but they're new in terms of being used for atopic dermatitis. They're also used by rheumatologists as well. And before that, there were very few medications onto a certain point with eczema, at which point you kind of had to say, look, we're at the end of what we can give you for your eczema. But now we've got this whole new, you know, area of medication which we can go to if the conventional, say, systemic treatments haven't worked for eczema. And by conventional systemics, I don't want to get too much into detail here. Some of you may have heard of these medications, but one of them is called methotrexate, another one's called cyclosporin, and these are immunosuppressive medications. And for many, many years, these were thought to be like, this is the end of what we've got there, you know, for eczema. But no, in the last kind of probably about 10 years or so, even, you know, probably 3 or 4 years with the JAK inhibitors, there have been some increasingly interesting, exciting developments, and people with kind of very severe eczema, which has not responded to the conventional stuff, we've been able to, be able to put on these new medications, and some of them are doing really, really well. And it's just nice to see that. So I've seen that Dr. EMB shared our lives, so that's very kind of you.
Hi.
So what do you think, Sarah?
Yeah, so that was going to be my answer as well. It's the obvious answer. But with eczema, we hit a wall for a very long time. We really had the same set of medications, and if you'd failed those medications, it was heartbreaking because there wasn't much else that we could do, really. Compare that to psoriasis, where, you know, we had these amazing, groundbreaking, emerging medications, over 17 biologic medications available for psoriasis at the moment. And we didn't really have that for eczema until about 2016, which is when the papers for the first biologic medication were published. But yeah, no, that's been amazing to see. I think that's been one of the most exciting emergent treatments for me to witness. It's been really exciting to be a part of it, you know, prescribing these medications for the first time and just seeing how effective they really are. Eczema can be a devastating condition. It really can. It really can affect people's quality of lives. And it's heartbreaking to see. So it's amazing that all this research is being done. So I think that's the most exciting bit for me in terms of the research aspect. I am. I didn't mention this before, but I am a research doctor, so we call them academic doctors. So I do get a couple of months a year where I am involved in some of this research. And my research personally has been in the biologic medications that we use in psoriasis. And I think it's incredible. These medications truly, I really geek out when I talk about them.
So we agree on that then. That both of our shared experience is the novel treatments for eczema and psoriasis. So it's interesting that we both say that. Luke asks, you spoke about cosmetic dermatology. Where is the separation overlap between derm and plastics?
That's a really good question. Yeah.
Because as you may know, there is a bit of overlap between the two specialties. Definitely in the cosmetic area, there will be similar procedures that both a plastic surgeon and dermatologist can do. So kind of fillers, Botox, that kind of thing. Plastics may go on and do some interesting things, kind of liposuction, of course, and some interesting cosmetic treatments from that point of view. Even in dermatology in the NHS, what I would say is that a lot of our skin cancer work tends to overlap. As dermatologists, when skin cancers get really, really big, we need to involve the plastic surgeons, and we need to have good relations with the plastic surgeons because they may need a complex reconstruction, which the plastics can do, which may involve kind of muscle, bone even. So that's where I think we link most closely is in skin cancer. And we have a shared meeting called a multidisciplinary meeting in skin cancer. And then we frequently meet plastic surgeons and get talking to them about our cases in those meetings.
Mm-hmm. Yeah, so sort of just to add to that, we do have dermatologists who specialize and do extra training in surgery, and they are trained to do complex procedures such as flaps and grafts, but often the really big complex procedures, the really big cancers, we do refer to the plastics team. So we do work really closely together. So yeah, it's very good to have good relationships with the plastics department wherever you're working. So yeah, that's a really good question. Thank you. Eczema can be really difficult. Yes, eczema can be really difficult. So yeah, we do get excited when new treatments are published.
Dr. EMB is asking, are you an ACF or doing an ACF? Did you do an ACF in the past?
I didn't do an ACF. I didn't do an academic foundation program. Yeah. I'm currently doing an academic clinical fellowship. So for those of you without a medical background, I'm a dermatology registrar who kind of applied via the academic route. So what that means is I get 4 months a year of research. So I'm just the same as any other dermatologist. I just get protected time to do some research every year. Would I recommend it? 100%. If you like research, of course. If you don't like research, no, I don't. But yes, I would recommend it. Feel free to message me separately if you want some more advice about that. But yeah, I would recommend it. I do really, really like research. The one negative is it's a lot to balance because I have to balance all of my clinical work and all of my clinical requirements with all of my academic requirements. So it's a lot. I've had to be very organized, but it's been worth it.
And also to say that even in the normal dermatology training program, we do research as well.
Exactly.
It's just not kind of built into our schedule, say, as much as it is for Sarah's. But I still do research every year, and I publish. I'm trying to aim to publish one thing a year, just like to keep the ball rolling. You probably more, Sarah, but that's my minimum. See if I can achieve that. Well, there's been a few questions now coming into the chat. It's good to see. Are there any advancements in treatments for patients with keloid scarring? Do plastics get involved there? That's an interesting thing because I'm doing some research in that area at the moment. I can't exactly say what the research is, but it's looking at keloid and hypertrophic scarring. For a long time, there was it's been very, very static. There haven't been treatments which have resolved these scars for good. I suppose we need to clarify what a keloid or a hypertrophic scar is. It's basically a big scar which becomes very fleshy and can extend beyond the actual scar margin where you've had, for example, an area of trauma or surgery, whatever, essentially. And it can be in more commonly in sites such as the ear. The ear is quite a one we see frequently, in especially people with piercings. And yeah, it can be difficult. I mean, keloids can recur quite often. I personally haven't referred many to the plastics team, just because we tend to manage them within our dermatological surgery units as well, and we can manage them up to quite a size. But what I would say is that, even when treating a keloid, if it's a particularly big one, they can come back either partially or even fully. And there is currently research out there to try and deal with them for good, but we're not quite there yet. Sarah, I know it's not your particular area, but you may know some other things compared to me. But
I think it's definitely an area we need more research, 100%. So that's an exciting field at the moment, because although we do have treatments for keloid scarring, they're not 100% effective. And the main issue is the fact that it can come back again. So I think that's the main limiting factor. But, as I said, the research world is fast evolving. So hopefully we'll have some more treatment options soon. So that's good. Can you tell if a mole is cancerous just by looking at it? Another really good question. So as dermatologists, we're trained to assess lesions, or moles, as you may call them. We're trained to look at them clinically, but we also have a little instrument. It's called a dermatoscope. It's kind of like a magnifying glass with a light attached. And we use that to magnify that mole. And we are trained to recognize certain features which may be associated with a cancerous lesion. But at the end of the day, what we need to do is we need to remove the lesion and look at it under a microscope to confirm whether or not it's cancerous. So those two things together, clinical and histological, kind of give us the diagnosis. So, yeah. Yeah,
that's very true. Certainly in my practice, if you think that something looks suspicious and it shows any of the features that, we've learned about what could be a skin cancer, then we would, essentially remove it and analyze it under the microscope in order to prove or disprove what we think, essentially. And, dermatologists being trained well, we, do get quite a high hit rate of getting the right answer first time and saying this needed to come out. So as Sarah says, it is a mixture of kind of clinical acumen and knowing when to do the surgery and remove that particular lesion. Any advice for a pharmacist who is about to begin independent prescribing in dermatology? Do you want to answer that, Sarah?
Any advice? Well done for doing independent prescribing. That's amazing. I know the exams are really, really difficult. I have a lot of pharmacist friends, and some of our nurse prescribers sit similar exams as well. And I know they're really difficult. So congrats on passing all of your exams and becoming an independent prescriber. My main advice is obviously safety. I know you know this already, but just making sure, you do all of your safety checks with regards to correct patient identification, checking all of their allergies, making sure it's an appropriate prescription. A lot of the medications that we use in dermatology, especially the tablet medications, do have, potential side effects related to them. So just making sure that you go through all of their medications and their past medical history, and just making sure that you are as safe as you possibly can be. But I'm sure that the training that you've done to pass these exams has equipped you for that. But I think that would be my main piece of advice. Also to keep up to date with the developments, especially with regards to therapeutics and dermatology. It's a fast-moving, fast-paced world. So I think keeping up to date and reading about the new medications you may be asked to prescribe is really important as well.
Yeah, no, I think that's exactly what I would have said as well, really. You probably know, drugs inside out and, all about side effects, indications, interactions, that kind of thing. So it's really a case of, I don't know exactly to what extent you'll be prescribing, but, if if you are kind of having diagnostic difficulties, it'll be important to link in with a dermatologist or a doctor, and just, making sure that you have the right indication, the right drug for that indication. Perfect. How difficult is it to specialize in the UK having done your undergrad in another country? That's an interesting question. I know that there are some postgrads who come from abroad into the NHS at a kind of senior house officer level, which means that just kind of post foundation training, or even some which come into foundation training from abroad. So you can be an international medical grad and apply for training in the UK. Now, I'm not completely clear on the specific restrictions and what countries are available, which countries are able to come over freely and be able to apply. And that's something you'd probably want to kind of take a good look at from a number of different aspects, like, for example, government advice from the UK, NHS kind of medical bodies which are dealing with foreign medical applicants, and that'll have lots of kind of good guidance for you if you wanted to come over. I would say it is possible, just like, for example, if we in the UK wanted to go to America, there is a route for doing that. Usually it's kind of, you do your medical student training here, then apply to study the USMLE and go in that way if a medical student wants to do that. But in terms of very, very much kind of specifics, I can't really offer you too much more than that, really.
Yeah, no, I think specializing in dermatology is difficult no matter where you've done your undergrad. So as long as you come to this, you're not at any disadvantage, is what I'm trying to say. So as long as you move here, you do the appropriate training, you check what the requirements are with regards to the application process, then as long as you've kept up to date with your portfolio, then it is possible to get the job. No, they'll never say, oh no, you did your undergrad training in another country. That's a definite no. That's not the case. But there may be extra requirements and extra hoops you have to jump through. So I would just double check that beforehand. But yeah.
Perfect. So shall we call it maybe the final question?
Yes.
We've been going for a little while, but lots of really, really good questions tonight. Thanks everyone
really
for asking these. We'll do our last question by Sajni, which is, what are your thoughts about these online dermatology companies like Skin and Me and Dermatica? And they've been around for a few years now, I think, but still quite new. Sarah, what do you think?
I haven't heard much about Skin and Me. I've not used any of these, but I have.
Neither have I.
Yeah, I've not used any of them. I have no sponsorships or affiliations, but I've heard a lot about Dermatica, and I do know people who have used it, and they have given favourable reviews. As I said, I wouldn't want to speak on it myself because I've never used it as a consumer, but I do believe that they have dermatologists working for them. Is that right? Yeah. So they have qualified dermatologists working for them, and I think they do an online assessment based on your past medical history that you've provided, and based on your skincare needs. So the idea of it, it sounds like it's quite a useful, practical way of getting personalised skincare. However, I'd probably want to do more research and maybe even use it myself before deciding. Yeah, have you used it, or do you know anyone that's used it before?
I don't know anyone firsthand who's used it. I know of the company. That's only so much as I know, really. I can see the commercial reason why they are there, because they're essentially trying to cut costs to the end user. So to offer you a service where you're getting prescription strength treatments at a fraction of the price. And I suppose it completely depends on what you were doing before. I mean, if you're going to a very expensive service and you're seeing maybe a private dermatologist for this one expensive cream, maybe it wouldn't have made much monetary sense for you, and you can get that service a lot cheaper online. But again, can it replace a dermatology service? I'd say no.
No, that is the disadvantage. It can't.
Yeah,
compare.
so I'd even be a bit hesitant to use it as a kind of, strictly diagnostic service. You'd want to see someone unless they see someone face to face, unless they have a dermatologist giving you at least like a video chat and seeing like going through a history and what's wrong with your skin. I don't think it quite replaces the in-person experience. And also, just another thing personally, I just wish that more of these companies were founded by dermatologists. So the people who've essentially found these companies are business people or financial backgrounds. So they have a kind of vested interest in trying to make as much profit as they can from these kind of ventures. Maybe in the future we'll see. In fact, we are seeing some more ventures from dermatologists making customized prescription strength skincare. So we're going to see more in that field. But I just hope that we can get more dermatologists being part of the founding teams, because
I agree.
because I think it's really important to have a specialist there guiding the process, and it not just be guided from a position of what's going to make us the most money, which of course the commercial world that's what it's just designed to do, to be a profit spinning machine. And I think if we can get doctors on board to guide things in a more ethical way, then I think we should be doing that. So that's my stance on things.
Yeah, no, so I do agree. The disadvantage is really the best and most ideal assessment is a face-to-face assessment with a dermatologist who gives you a tailored and customized treatment plan. But unfortunately, not everyone has access to that, and it's not feasible for everyone. But in the ideal world, that would be the gold standard. Because we go through so much training and we know so much when it comes to the skin, the pathology of the skin, and the different cosmetics and how they can be used, I do think that more companies really should have clinical dermatologists as part of their founders, 100%. I've seen that there's your app. I'll just give you a shout out. So he has my light's just turned off. Sorry about that. But I've seen that your app that you've developed.
Quick plug at the end here. Yeah. So anyone who's interested in kind of essentially what the app is aiming to do is essentially be your skincare routine in your phone. So if you have problems with administration of your skincare, just want to kind of have new ideas on what changes you can make to your skincare routine, or just help you stick with your skincare routine in the future, we have developed an app called Toppy Skin, which aims to be that kind of skincare buddy kind of thing that we all need, and kind of in the future helping to make kind of better decisions for patients, and help guide them towards a particular product which would be more useful for their skin than other products. And that's where we're going. We're still early doors, but yeah, any support for that would be great.
Yeah, I mean,
and
I promise you, he hasn't told me to say this, but it really does.
I would obviously did. Yeah.
So I'm really excited to see where that goes, because I really think that's what the skincare space needs. There's like a big gap there, so that's exciting. But thank you so much, everyone, for your questions. I've had a really great time. I hope you have as well. But yeah. Thank you.
Absolutely. Thanks everyone for turning up, and hopefully we can do this again at some point in the future.
Definitely. Definitely.
Let us know. Give us your feedback.
Yeah.
Happy to take DMs. If anyone wants to DM me who's on this call, more than happy to chat on there and say if feedback exactly how it went and what you'd like maybe different in the future.
Less technical difficulties, I promise.
Yeah. Maybe. Yeah.
All right. Okay. Thank you, everyone.
Cool. Cheers. See you guys later.
See you guys later.